Hello. I'd like to thank Syed for inviting me to speak with you today. I appreciate all of the work that he and his team have been doing, both in the region and globally, working in the health misinformation space. My name is Purnat. I'm the team lead in the newly established team for infodemic management at the World Health Organization in Geneva, Switzerland. And I'd like to speak to you just briefly today about how we think about health misinformation, disinformation, the infodemic, and how it relates to response to COVID-19 and also to enactment of health behaviors. I think that I don't need to tell you a lot about the experience and the challenge that health misinformation, disinformation have posed, have challenged us with. This is actually an illustration that we use to basically show, how we've learned that the narratives evolved constantly over the course of the pandemic. Really better understanding how they change and shift over time would really help us health authorities to address the infodemic more quickly. And what it of course makes it more complicated that these narratives affect people's behavior, and this depends on people's beliefs and their trust in institutions and their connection with communities around them and that they're part of. So this isn't really the first global pandemic that we've experienced. So it's certainly not the first time that people had a very disproportional access to clear and accurate and timely health information. But if this isn't the first time we've faced something like this, why is it so hard to manage it? And I think looking back at the last 2 years, it's because of two things: the scope and the pace. So when we started thinking about the infodemic at the WHO, we originally thought of it in terms of disinformation and misinformation, but it actually didn't really take long for us to see that that understanding was short-sighted from the point of view of promoting health behavior, acceptance of public health social measures, acceptance of vaccines. So yes, mis and disinformation are a part of the infodemic, but the reason why this thinking is narrow is because we realized that people were struggling just as much with information that used to be accurate but was now outdated. They were also struggling with information overload and even with just the fundamental confusion of the situation. And we're still experiencing this today. So digital platforms were the infodemic's original and misinformation's original breeding ground, but the incredibly fast pace of the infodemic comes from how it spreads, from online exchanges to offline interactions, and then back again, and often through photos and videos, which are currently very poorly analyzed, detectable for context. So we very poorly understand the dynamics of the infodemic and what's actually going on, how to best respond to it. So going forward, there's a couple of things that we think that health authorities can do, also with your community help. We know that we need to address information voids. So this means first proactively anticipating what people's concerns, worries, and questions are, so that then our communications response can meet the needs of people at any one time for information, but also so that our health services, the way that we provide access to vaccines, the way that we the way that we design policies for the response and mitigation of the pandemic, so that they also meet needs of people, so that they are they have a better chance of being enacted. So this thinking, I think, and this type of action is really low-hanging fruit for health authorities. For every health authority should be able to address them instead of just chasing mis and disinformation. Also, from point of view of public health, the way that we're thinking about adherence to to public health social measures, acceptance of vaccines, is really thinking about maintaining the trust and relationships between communities, population, and the health system. When there is a misalignment between what the population needs and the action that the health system takes, then people will have their own personal reactions to guidance, to recommendations on how do they protect themselves. And this results in a variety of behaviors, some of them not health behaviors. And this ladders up to population behaviors that then can be detected by various data sources, both within the health system and outside of health system. And some of these population level health behaviors can be detection of poisonings because people are using unproven treatments, or delayed seeking of care because people are using unproven prophylaxis, or etc. So, if there is continuous misalignment between what the health system provides and what the population needs, this actually continuously challenges the effectiveness of the pandemic response measures and can become a self-reinforcing cycle that can worsen the infodemic. It generates more mistrust, more misinformation, more vulnerability to the infodemic. So we really need to make sure that we step out of this cycle and that the infodemic management can help us adapt to this challenge. What would be an example of this misalignment? For example, continually assuming that people are going to continue adhering to the same type of pandemic control measures that worked in the previous wave of COVID-19 infections, but we don't actually consider what is the lived experience of people. How are they experiencing the crisis and the situation today compared to 5 months ago, of the previous surge? This is really important to consider in public health, from public health angle. So I'd like to leave you with 3 concepts. We've been thinking really about, we need to respond, we need to prepare to respond, but also if we want to have any long-term solution in imagining a healthier information ecosystem, we really need to think about prevention. So when it comes to responding, well, we do need to be much more competent firefighters. Health authorities, this requires that we really get better at producing quick and accurate, attractive, attention-grabbing, and highly engaging health information that is at least as convincing as what the peddlers of disinformation are spreading. And at the moment, really, health authorities are still trying to use a garden hose in an age when the private sector, we know, has access to a high-pressure hose, not even a fire hose. Not only are the most virulent false claims and rumors and conspiracy theories more attention-grabbing than the messages that we produce at health authorities, they also spread much more quickly than the health authorities that we can actually even track. So there are basic things that we still need to develop, that we need help with, that we need to work with the broader community to address. And of course, part of the response are also tactics that we've been using, that have been used, that needs to be used carefully, like deplatforming and flagging of outdated information and science communication, etc. So while we firefight in some areas, we also need to fire marshal everywhere else. And this means that we need to be better prepared to respond, because infodemics are here to stay and crisis will continue laddering up. What's clear is that basic infodemic safety precautions haven't really been put in place. And what we do need to do is invest more into systems and structural changes. Also from the point of view of how we prepare health authorities better to respond. So at the moment, none of the systems that might detect infodemic signals in health are integrated or aligned to allow integrated analysis and then very quick turnaround into recommended actions in the response. So at least in the health field, I would say that we're still lagging behind with very basic things like use of permalinks for health information so that our content is more discoverable, or that we build large enough partnerships with trusted messengers and anti-hoax activists in different countries to be able to address health misinformation in different communities, online and offline, or basic things like keywords and hashtag audits that on our websites that would help health authority websites to just be more useful and discoverable in the digital ecosystem. And lastly, there's this concept of prevention. So, the way that I like to describe it is that a city can have the best firefighters and the most committed fire marshals, but if every building in the city is made entirely out of paper, eventually it will still burn down. And in the same way, when we're thinking about vulnerability and the infodemic catches fire in the community, in the first community that becomes vulnerable to the infodemic spread, and that's the community whose questions, concerns, and needs go unaddressed. So some of these questions, concerns, and needs might clearly be health-related and health authorities can address, but others might be ancillary, which means that we really need to be also thinking about how we work together to address people's concerns. And all of this needs to be understood, and all of this needs to be worked on together to meet the needs of communities. So I call this fireproofing, and it basically emphasizes prevention. So just to conclude, the infodemics and information overload are here to stay, whether we're in an emergency or not. And we need to build tools and procedures and networks that will allow us to coexist with it. This is where prevention comes in. So the way that I like to think about it is that the way that nowadays weather channels in California, in addition to their weather forecast, also predict chances of fire. Ideally, we need to get to the point in our partnerships and in our systems that infodemic management, ideally in infodemic management, we should reach the same point where we can calculate the risk of infodemic outbreaks and also the effectiveness of the prevention activities that we're implementing. So I would like to thank you at this point for all of your hard work. I know that a lot of you who are here today have been supporting and helping and partnering with health authorities in the COVID-19 response, responding to health misinformation, responding to the infodemic the last 2 years. And I hope that we continue working together and finding effective ways going forward in how we not just respond and prepare, but also build prevention and imagine a healthier information ecosystem. Thank you.